Hey everybody, hope everybody's locked in, not having sleepovers, not having play dates, not having family get-togethers, staying away from people, protect yourself and protect other people. I have one question. It's not a nice question, but it's good to know the answers to things. So if you want to listen, that's fine. If you don't, you don't have to. The question is specifically, what exactly about coronavirus kills you? So the answer to that question is coronavirus, or SARS-CoV-2, the specific coronavirus, it doesn't kill you. It doesn't want to kill you. It just wants to live in you to multiply and eat. If you die, then it dies. So it doesn't want to kill you. What happens is that our bodies overreact. Our immune system goes into overdrive to try and kill this virus, and then we end up compromising ourselves. Normally we get some invader in us, and we try and cough it out, or sneeze it out, or we turn up our temperatures. We turn the oven up to try and cook it out of us, or we get fevers. It's like getting out of your car in August in Miami. You just say, I can't live here. So it's the same idea. We try and cook the bugs out of us. This specific virus ends up getting in the back of our nose, migrates down to our lungs, and kind of sits there and entrenches itself. We can't cough it out anymore and sneeze it out. So now we send our blood flow down there, and we increase our blood flow, and the blood carries chemicals and antibodies and mediators, things to stimulate our immune system to kill this virus off. As a result of that, in some of us, we overreact because of our underlying conditions, or our age, or our health status at the time. And when we overreact, a complication of that is our blood vessels, especially by the lung and in the lung, start to leak. Not blood, but just fluid through the walls, because the walls get leaky. And this fluid ends up being a barrier for oxygen to get through. And the overreaction is like I'm a man, so I'll use a man example. My wife calls me and says, Mike, my water broke, meet me in the ER, everything's fine. I'm not in labor, but I'll be here. Then I overreact and I drive 95 miles an hour and I go through red lights and I yell at people and I go over curbs and I crash the car and I end up in the ER myself. And then I get there and my wife says, Mike, that was totally unnecessary. I told you, you just overreacted. It's the same thing with the body, that our body overreacts. So I have some slides. I don't know if this is helpful in explaining things, but the basics, which I'm sure we all know, is that we have our windpipe and we breathe air, and then the air comes down here and it goes in our lungs, our right lung and our left lung. But if we go all the way down to the microscopic level of our lungs, we have all these little teeny tiny balloons. They're called alveoli. And the oxygen comes all the way down here to these alveoli and then transports itself into the bloodstream. These are the blood vessels. And then these blood vessels carry it to the rest of our body to feed our brain, feed our heart, feed our muscles so we can function. So if we look down at this alveoli, we see these blood vessels. And these blood vessels go right by this little tiny alveolus, and the oxygen is in here, and it just walks across the street. Here's a little street from the one house, walks across the street to the other house in the bloodstream, and then the oxygen is carried to the rest of the body. It's just simple diffusion across this, or a walk across this street. Now let's say you have a neighbor, elderly neighbor, and she can't get out much. She's not very ambulatory, and you say, don't worry about anything. I'm going to bring groceries to you. I'll cross the street, bring them over to you, you can eat, and you can go on with your life and get your energy. And she's thankful, and everything's great. So you start taking the groceries across the street, everything's wonderful. Then it starts to rain. So the street gets wet, some of the apples fall out of the top of the groceries. You say, that's fine, it's not a big deal, I'll just take more groceries next time, and I'll compensate. Now it starts to flood more. And now you can't get across the street as easily. And now some of the groceries are spilling more on the ground. So you're not able to get as many groceries to her as you wanted to. That's kind of like how it starts with COVID-19. First there's a fever, a cough, then it comes the shortness of breath. And that fluid starts to accumulate in the lungs or the street across which you have to go with groceries, and the street across the oxygen has to get. So the water starts to get in the way. To supplement that is you take more groceries, make groceries available. Even though they spill out, you're still getting more groceries to your neighbor. Same with the oxygen. You increase the amount of oxygen available in the lungs, knowing that not all of it will cross into the bloodstream. Then it starts to flood more. And now it gets a little bit harder to take the groceries across the street. You have to get a raft or a canoe. They're still spilling. There are things in your way now. There's debris, garbage, tires. Same in the lung. Now there's fluid there. The water's in your way. The white blood cells are in the way. You have to get that oxygen across the street into the bloodstream. And then you have to increase the groceries, increase the oxygen flow to the lungs because you're losing more and more groceries, or you're losing more and more oxygen by the time it crosses into the bloodstream. Then you get to the point where the house is almost flooded and you can't get anything across the street at all. And that's the case in the lungs. You can't get the oxygen across the street into the bloodstream, and you're left with going on a machine. And that ventilator takes 100% oxygen and with a higher pressure forces it across the street, or forces it across that street between the alveolus and the blood vessel, knowing that you can't get all that oxygen in there, but at least you're getting more than you could have if you didn't use the ventilator. Now the machine does not cure you. The machine maintains you. It keeps you alive while you cure yourself. So when you overreact and you flood your lungs, the ventilators help keep a minimum amount of oxygen getting across to keep you alive until you get rid of the fluid. If your body cannot get rid of this fluid, then there's nothing anyone can do. It comes down to you eventually healing your own body and getting rid of this water. And these extra measures, the oxygen, nasal prongs, the mask, the ventilator, they just maintain you until you heal yourself. So that's the answer to the question. The question being, how does the virus kill you? The virus does not kill you. It's our body's overreaction, complication of our flooding the street between our lung and our blood vessels in a matter of time for us to recover from that. So that's it. Thanks very much for watching. I'm always open to criticism. If you don't like this, if you like it, please feel free to tell me. Please stay safe. Now's not the time to celebrate. It's not the time to experiment. Keep yourselves and your families locked down. Thank you, and I hope you have a healthy week. Bye-bye.